Chapter 5 Physical Activity. Physical activity is a broad term and it deals with anything that moves the muscles in the skeletal system. For health professionals, we like to only think of physical activity that is something that benefits health. Physical fitness is the capacity of an individual's biological system to carry out physically active tasks. And exercise is planned activities that are structured and done to improve or maintain physical fitness. Types of physical activity. So when describing physical activity, factors that are used are duration, frequency, and intensity. Duration is the length of time, usually in minutes or hours. Frequency is how often the individual is active, and people usually use days per week. And intensity refers to the level of effort required to perform an activity. So the metabolic equivalent is used, and that is the MET. And it's the energy cost of any physical activity. And there is a formula for that on page 141 at the bottom of your textbook. Sedentary behaviors, which uses the least amount of effort, is where you sit, lay down, watch TV. Intensity or light intensity activities are moderate, and that's where someone is doing chores around the house like cooking, slow walking, washing dishes. Moderate intensity activities are those that increase the heart rate and can make you sweat. That's walking up and down the stairs and riding a bike. Vigorous intensity activities are when people are trying to do structured exercise or they have a health goal in mind. And that could be playing soccer, jogging, or rowing. The most common way to assess physical activity is through self-report, and people are just basically reporting how often they exercise, for how long, and reporting the intensity, and that could be through surveys and questionnaires. However, of course, that leaves bias, and that's where people don't recall exactly how much they worked out, or they will work out more just because they feel they're being questioned or observed. This can reduce the reliability and the validity of the self-reported measures. There is the International Physical Activity Questionnaire that can be used as a population-level physical activity surveillance. So it's not an individual surveillance tool. For objective measurement, we have pedometers and accelerometers. And the pedometer is the most common one. It's used to track walking or running. It's worn around the waist or below. But accelerometers have small microchips, and they basically account for the gravitational force acting on the device, so that's the G-force. But it's not going to track anything such as swimming or anything that's above the waist, really. Direct observation of physical activity is where trained observers watch people and they track how much activity they are using or doing, and they have their specific notations and a classification system already outlined. There are some commonly used methods, and that is the system for observing fitness instruction time and the system for observing play and leisure activity in youth. The disadvantage of this is that people will try harder or work harder when someone's watching them, but that's just an observer effect. And then also that it could take a lot of time to do this and a lot of space, especially if you're watching children run and play. Mortality. Premature mortality is death that occurs before the expected time. So currently the U.S. is at about 77.3 years for an average life expectancy. There is a dose-response relationship, so if someone has more physical activity, that can decrease their early mortality by 20 to 30%. Cardiovascular disease are diseases that revolve around the heart, the arteries, the veins, blood flow from the heart. And heart disease is still the number one leading cause of death as of 2020. Metabolic health and obesity. Physical activity affects the function of essential metabolic systems. That includes insulin resistance, type 2 diabetes, and excess weight. So as of 2020, according to the CDC, 41% of Americans are obese, 69% are overweight, and 9% are severely obese. Muscular and skeletal health. So physical activity is really good for building and preserving the health of muscles, bones, and joints. Especially when it comes for children, it gives them strength. It tells the bones to grow. It tells the muscles to grow. It helps with motor control. And when it comes to older adults, as in the elderly, it helps prevent against osteoporosis, fractures from falling. Mental health. Many Americans experience mental health issues. The majority of adults in America will experience at least one mental health break or one psychotic break during their lifetime. And that could be situational, maybe the death of a family member or PTSD from an accident, military, being a first responder, sexual assault. So there are a number of reasons why people do experience this. So it is common. The most common ones are anxiety and depression when it comes to mental health. So in 2021, 39% of the U.S. adults reported having depression or anxiety, and that number has decreased to 32% as of 2023, and this is from the Kaiser Family Foundation. Most of the time, it's treated with medication and, of course, therapy. But research indicates that exercising sets off endorphins, norepinephrine, dopamine, and it gets people feeling more positive and more happy. Many Americans report experiencing sedentary behavior, and that's when people are sitting for a large number of hours during the day or laying down. They don't have much movement, and that leads to negative health outcomes. It can lead to weight gain, obesity, cardiovascular disease, metabolic syndrome, type 2 diabetes, increases the risk of ovarian cancer, and increases the risk of colon cancer. The U.S. Department of Health and Human Services has guidelines and recommendations for physical activity, and that is about 150 minutes per week. It does not have to all be at the same time. It can be broken up throughout the week, and that's only for moderate exercise, walking, jogging. But for 75 minutes, they want vigorous physical activity or like a combination of the two. And that would be running an actual exercise plan or workout plan, swimming, anything that's going to get someone sweating and your heart rate really increased. And research has shown that only about 5% of adults actually meet these guidelines. Physical activity interventions. There are interventions that will be on 4 levels of the sociological model. That will be the individual, interpersonal, organizational, and environmental levels that we are going to discuss. On the individual level, it is important to have behaviors that deal with changing, behaviors that deal with the person feeling successful. And the first one is self-monitoring, and that's giving the person the information and education they need in order for them to record their own behavior, and then for them to self-monitor themselves. They can keep a log or a diary of their behaviors. They can use a pedometer. They can track their steps. They can be honest about their current diet. Another intervention at the individual level is intention formation. So having people set goals in mind of what they want to accomplish with their health, and then they can modify those goals along the way. Then there is goal setting and review, and that's going to help the people create a plan of action of how they're going to actually reach these goals, and they can use SMART goals in order to do that. And it's good for people to think about where they are and where they want to be, and they could adjust over time. And feedback. So it's very important that people have feedback provided to them to help with behavior change strategies. And so someone can give feedback on how much they're exercising and what they're eating and what's working for them and what isn't working for them. Important methods for intervention would be face-to-face as the gold standard, and that could be a health counselor or a physician, nutritionist, a trainer, somebody who can work one-on-one with this person face-to-face. There are many advantages of this. There's personal contact, there's communication. The patient or person can get immediate feedback, and the counselor or person who's delivering the information is able to give all of the information at once, and then get the response from the person to make sure they understand. They can ask questions. So the drawbacks could be that this could be time consuming and cost money, and there's only access to a small amount of people if you're doing it face to face. Then there is tailored print and electronic material, and that can reach a large number of people because it could be easily accessible. It could be promoted using mass media or social media. This information could also be sent through emails or text messages, and the cost for that is relatively low, but you could reach a lot of people. Also, it can be customized, so there could be like a basic information could be sent out, but some of it could be tailored for each specific customer, so it could be customized for them, and that'll help people actually read the email and feel some connection in order to get that information, and that way they're able to also get feedback. However, of course, you have to take into account that the person has to read the email and actually spend the time to open it, to look for it, and then respond to any surveys that might come out through the email. Then there is mobile communication. So text messaging is great, of course, push notifications through apps, and the messages could once again be tailored to each individual. It's great because you can reach a huge number of people. It's inexpensive, and people can interact right back with the system. Some surveys will come and ask them questions 1 through 3, and the participant can just respond using numbers. So it's also quick and it's easy. Interpersonal level interventions. Research has shown that people have better health when they have better relationships with others, and those are through social networks and social support. Social networks refer to the social structure that basically ties people to one another, and those ties are called nodes. So what makes others tied to one another? That could be through a common interest. It could be through finances, a business, friendship, family, if they like something, dislike, sharing common beliefs and knowledge. So anything that ties one to another one. And social support is a social network function also, and it encourages individuals to share with one another, be in camaraderie with one another, and they give support. So there are different types of support. There is emotional support, that's sympathy, care, understanding. Instrumental support, that's helping somebody or giving them assistance with material resources, like paying their bill or helping them clean. Appraisal support is giving somebody feedback or helping them with decisions that are important. And informational support deals with providing advice or information that a person may need. Interpersonal methods of promoting physical activity. So these interventions can focus on physical activity through informal networks and formal networks. So by enhancing social supports, informal networks are family and friends, and formal networks are health coaches, healthcare providers, community health workers. So they can provide skills, influence attitudes and behaviors, and research has shown that this is more effective for women than it is for men. Environmental level interventions. The physical environment refers to environments that are modified by humans, and that will be homes, schools, workplaces, pollution, transportation systems, highways, and then the social environment are forces that shape availability and choices for physical activity. So that would be climate, power relations, inequalities or equalities, religions, cultural practices, cultural norms, political forces, and also societal forces. And there are many studies that show or demonstrate that if people have access, like the social environment access to a physical environment, they are more likely to exercise. An example of that would be if people have sidewalks, then the people in the community are more likely to walk versus using a car. Policy and the environmental level. So policy can be part of the environmental level. When looking at the social ecological model, it just depends on which one you're looking at. Otherwise, policy is its own layer. But policy refers to any laws or actions taken by local, state, or federal governments that influence behavior by mandating a certain behavior or inhibiting others, like having people having designated areas where people can smoke outside, or mandating that people mask or have social distancing. So there are some policies that are explicit, and then some are implicit, but they all require social support. So policies can indirectly and directly influence people's exercising. So by a policy indirectly influencing physical activity would be by making a neighborhood more safe, creating areas where people can exercise outside where it's free, and by directly encouraging people to exercise would be how a city is designed, having more stairs available, having signs or posters telling people to use the stairs. That always tends to help. Policy and physical activity. So there's evidence from research that demonstrates children will exercise more if the education and the increase of physical activity is targeted for them while they're in school for a certain amount of time. So that's why it's really important that schools keep physical education. I know all schools don't have that as a requirement, and some of those programs have been cut, but it really helps students engage if they're not already in a sport or have another activity where they maintain exercise. And it's also important for the faculty and staff to be involved, and then for the families to be involved. And also, if the school environment is improved to where children have access to run, for track, or have access to fields. Policy and environmentally focused interventions, so through the government. That could be increasing safety in parks, having walking paths, having urban planners work with parks to plan the cities, adding parks, adding places where people want to get out and walk,